Hi, I'm nurse practitioner Melissa Brooks.
And I'm Dr. Catherine Hansen.
We're both providers at Sawtooth Mountain Clinic, and we're going to go over the birth control methods available at SMC, as well as why you might choose one method over another.
Generally speaking, there are two different hormones involved in the menstrual cycle that are also involved in birth control options. Estrogen rises during the first part of the menstrual cycle and grows the lining of the uterus. So if fertilization occurs that month, then there's a very good blood supply to grow a baby. Progestin sheds the lining of the uterus and raises during the second half of the menstrual cycle. This is when you might get a period, also known as your menses. Generally speaking, estrogen and progestin combined birth control methods are methods that you need to think about day to day or week to week. Usually progestin-only methods are methods that last longer.
One birth control method that contains both estrogen and progestin hormones is the NuvaRing. As you can see, NuvaRing is a small, flexible ring that you wear inside your vagina, and the hormones are absorbed through your vaginal lining. Each NuvaRing lasts for up to 5 weeks, and about once a month you take out the old NuvaRing and replace it with a new one.
Another birth control method that contains both estrogen and progestin hormones is the combination pill. This is a pill that you take daily and is very effective if you remember to take it every day.
Birth control pills also come as progestin-only pills, without estrogen. You must take progestin-only pills within the same 3 hours every day to be protected from pregnancy. All birth control pills require a prescription from your provider, except for O-pill.
O-pill is an over-the-counter progestin-only birth control that you take once a day. You can purchase it at the Sawtooth Mountain Clinic pharmacy for around $25 a month. While O-pill does not require a prescription, we still recommend talking with your healthcare provider before starting the O-pill.
The pill and NuvaRing are both great options for someone that doesn't want a long-term birth control device placed, but for some it can be stressful to remember to take a pill every day or place a new ring monthly. If this sounds like you, Depo-Provera is another method to consider. This is a birth control injection that releases progestin. You'll need to visit the clinic every 3 months to get a new shot. For best efficacy, the timing is very important.
If you know you don't want to get pregnant for a while, then a longer-term device is a good low-maintenance option. Nexplanon is a small implant that's placed under the skin of the non-dominant arm and releases progestin. Nexplanon is good for up to 3 years and is one of the most effective birth control methods because there's little opportunity for user error.
This is similar to an IUD, or intrauterine device. This is a small, T-shaped device that is inserted through the opening in your cervix and into your uterus. The hormonal IUD releases progestin and can last from 3 to 8 years, depending on which brand you choose. Sawtooth Mountain Clinic offers Mirena, Kalena, and Skyla, and your provider can help you decide which one of those would be a good option for you.
The hormones in hormonal birth control can cause side effects in some people. You may experience spotting or changes in your menstrual cycle, headaches, breast pain, or nausea. Usually these symptoms go away after the first couple of months. There are also certain medications and supplements that may reduce the efficacy of your birth control. You may decide that a non-hormonal birth control option is better for you. Paragard is a hormone-free IUD that is wrapped in a little bit of copper, which prevents sperm from getting to an egg. Paragard is good for up to 12 years.
While all these birth control methods are very effective at preventing pregnancy, when used correctly, none of them protect against sexually transmitted infections. The most effective way of preventing both pregnancy and sexually transmitted infections is to use a birth control method and a condom. Condoms should also be used during sex if you miss a dose of your birth control or if you took it later than normal. A variety of different condom types can be purchased at the pharmacy or found in the clinic's bathrooms and waiting room.
An emergency contraceptive, also known as the morning after pill, can be used to prevent pregnancy after unprotected sex or when another form of birth control has failed. The most well-known morning after pill is called Plan B. You can buy this at the pharmacy or at the local holiday gas station. It should be taken within 3 days of unprotected sex. The pharmacy also carries Ella. This is a prescription emergency contraceptive that is effective up to 5 days after unprotected sex and is a better choice for people who weigh more than 155 pounds. Both can be good options in an emergency. However, they should not be used as your regular go-to method of birth control.
This was a lot of information, and it still might feel overwhelming, choosing which birth control method is right for you. The providers at Sawtooth Mountain Clinic can help you make this decision, and sometimes people have to try a few different methods before they find one they like the best. If you have concerns about paying for services, sliding fee scale is available, and you can inquire at the front desk to see if you qualify.
If you're under 18 and want to speak to your provider about birth control, but don't feel comfortable with your parents knowing, you can schedule a confidential appointment. We'll ensure that no information gets passed along to your parents through appointment reminders, the patient portal, or their health insurance.
And if English isn't your first language, we offer an interpreting service with over 200 languages.
Thanks for watching.